Good morning from San Antonio, Texas. I'm Dr. Doreen A. Lewis. I'm a doctor of chiropractic. I'm board certified in nutrition. I'm board certified in functional medicine through the American Chiropractic Association internal diagnostic program. I'm a certified clinical nutritionist. I'm an acupuncturist, and I'm a former lab tech trained through Baylor University, so through the Army Reserve. So I've got a pretty holistic and well-rounded view of some of the causes of diabetes that are not known to many, and I want to share these with you since diabetes is on the increase. There are over 23 million people diagnosed with diabetes, and the rate is growing actually by the minute. So I want to share these, including juvenile diabetes, which is type 1, and that's 5 to 10% of the diabetes out there is juvenile diabetes. It's an autoimmune disease where the body, actually the cells in the pancreas are actually attacked and they die off, where you no longer can produce insulin. And there are many, many theories from virus. There are viral theories, all sorts of theories. The things that I see most commonly are a milk allergy. People don't realize that children do not need milk. They are not baby calves. They do not need milk. The milk is actually such a toxin in certain babies, especially your blood type O babies, that it'll cause chronic earaches, it'll cause colicky babies, bedwetting problems. Those are little ones that just absolutely positively don't need milk in their system, and if it reacts so violently in them, it can actually go to the point where it destroys the cells in the pancreas that produce insulin, and then they're stuck on insulin injections the rest of their lives. So if your child is having some of those symptoms, think twice about switching to a different type of formula, or stay with breast milk. And the next thing I want to talk to you about is something else even more serious. It's the HIV vaccine. This vaccine is given to little ones, and when there's no more HIV left in the child's colon, that vaccine will turn and look at the next closest thing to what an HIV molecule looks like, or element looks like, and that's going to be a beta cell in your pancreas. And when that HIV vaccine attacks that pancreas, that child is going to be permanently again on insulin the rest of their lives, which will shorten their life expectancy. You know, we know God's in control, but sometimes we do things to the body that shouldn't be. So I want you to think twice about that and just pray about it. Get on your knees with your husband and pray over that baby, and pray about what things you should and should not do with your baby. The next thing I want to talk to you about is gestational diabetes. That is still a major problem. 7% of the pregnant ladies get gestational diabetes, and it's only a temporary thing, but the bad part about it is that 50% of those ladies are going to end up type 2 diabetes with type 2, and that's not a good thing. If you've ever had, I have diabetes everywhere in my family, type 1, type 2, and alcoholism. And the hard part about this is what I found is most people that have this actually don't digest proteins real well. So again, that's the milk allergy that goes back to problems with possibly even gluten. But there are other things going on there, and I want you to know that there are even drugs out there that can cause type 2 diabetes. I know this sounds crazy. I want you to research drugs. If you're taking medications from your medical doctor, those can actually produce diabetes. And the most common drug that I see that my patients come in taking are blood pressure medications called ACE inhibitors. And those actually deplete the body's levels of zinc and sodium. And if you're not taking zinc, you rob the body of its ability to detox the liver. And that can be a major problem. You can't detox the liver, you can't change your glycogen into glucose, you can't control your blood sugar levels. If you have no sodium, again, your adrenal glands are little bitty glands on top of your kidneys on the backside. Those adrenal glands control your blood sugar. It's not your pancreas, it's actually your adrenal glands. And so if you have no salt in your diet, and I don't recommend going out and getting the typical white salt, I'm talking about if you don't take sea salt in, which is a natural alkalizer for the body, those things can actually put you right back into diabetes. So beware of that. And I would really recommend that you go out and get a book on drug depletions, and they're available. A lot of pharmacies that out there will actually sell books on drugs and books on drug depletions, and I really recommend you know what goes in your body. Don't just take any doctor's word for anything, including mine. Go out and research. It's such an essential part of your health. Take control. The next thing, and this is brand new information, I was reading one of the medical journals last week, and MLO journal, and they actually had a study from research quoted in Cell Magazine 2002 that sodium biphosphonates. These are all the drugs that women are taking. They're taking to build back their bone. These are actually causing diabetes. Yes, you heard me right. Sodium biphosphonates, what they're pushing for all women with osteoporosis and to prevent osteopenia and those type things, they can actually cause you to go into diabetes. Now, I know these are not the only drugs out there. So you're going, well, what's the mechanism on that? And I'm going to share this with you. It's kind of a little bit complicated, but when you take a drug that kills off the cells that break down and build up your bones, you actually destroy the body's ability to produce osteocalcin. Osteocalcin is just essential for your body to utilize glucose. And if you don't have that, yes, even a sodium biphosphonate bone builder, or so-called bone builder, can cause a major, major problem with your health. So I want you to be aware, again, talk to your family doctor, talk to your doctor of functional medicine, your chiropractic internist. These people know and study all the time. We are concerned about your health. We want to help. But take this on yourself. Go out there and research this yourself. When I look at type 2 diabetes, there are several triggers that come into my office that I automatically just go, whoa, let's check you. And what I mean by that is one of the common things I get is earwax. Did you know if you have lots and lots of yellow earwax, you have a high risk for sugar handling problems? When somebody comes in complaining about this, I used to just tell them to go ahead and get something from the drugstore to clean it out. Now I say, well, come on back here. We're going to pull a fructosamine or a hemoglobin A1C and check your overall blood sugar. That's important to do. So if you have lots of earwax, you may be getting into too much sugar. Don't know the mechanism, but just trust me, it's classic. Everyone I've seen that comes in my office with that problem checks positive for diabetes. The next thing is I have people with sore feet in the morning. They get out of bed and their feet just ache and burn. What happens is when you eat this sugar and you can't digest it because technically type 2 diabetic is allergic to it, so you eat this sugar, that sugar stays in your joints. And it's going to stay, in the morning you won't be able to get your rings on and off, or your feet will be really sore. And you put your feet down in the morning and whoa, it burns. That's a classic sign that you may have some blood sugar problems. Another one, and I catch a lot of diabetics this way also, is they'll come in with shoulder blade pain. I'm talking about the left side of the shoulder blade, that little wing bone in the back, at the very base there on the left side. If it's sore all the time, classic sign of blood sugar handling problems. So if you do have blood sugar handling problems, I definitely want you to get this checked and stop eating the junk food. When you eat excess sugar, junk food, your body cannot produce and function the way God meant it to function. So add zinc back into your diet, fresh water, skip the coffees, teas, definitely skip the sodas. You're going to be a lot healthier. And just even doing that, taking a little bit of chromium, taking a little vanadium, alpha lipoic acid, fabulous for neuropathies. So that will help you a bunch with that. But even if you have type 1 diabetes, things like magnesium, B7, and zinc, and a chiropractic adjustment can actually help you start and keep the insulin producing that you do have going. So there's always answers out there. I want you to search diligently for them, and I wish you God's best in your health and your walk for health and your serving God. My name is Dr. Doreen A. Lewis. I'm in San Antonio, Texas, 210-490-9169, and I appreciate you. God bless. Thank you.